Who's going first, Nancy or me?
Dr. Geller, you are first.
Okay. All right, then let's move the slides along, please. Thank you. Keep going. Okay, so I'm going to go through this fairly quickly because we have limited time, but I want to frame this. This comes out of our work from I Promote Illinois, which is a HRSA-funded grant. And we have formed a task force, and one of the committees is the root structural causes of maternal health inequities. And we are largely focusing on housing as it's a social determinant of health. And we know that where you live can affect inequality on multiple levels: social, environmental, and health. And this is especially true for women and for women of color. And our focus on housing is that historic housing discrimination policies and practices have and continue to influence maternal and child health outcomes. And we talk about both women and children because logically they cannot be separated. Next slide. So I'm going to present to you some of the data. I think these slides were sent out to all of you so you can look at it much more carefully. But we know from research that pregnancy can increase an individual's risk of becoming homeless, and that pregnant persons also face significant greater risk if they're unstably housed, and that the probability of a woman who's on Medicaid, any kind of public assistance, her probability of being homeless is much higher than if she's not on public assistance. So definitely one's economic stability is obviously correlated. And this is even more true for young women, teenage women who are pregnant, and are considered, in fact, children themselves. Next slide. And one of the challenges that we see with housing instability, for women who are pregnant or even in the postpartum period, is that their inability to access quality prenatal and postpartum care in a timely way, and even problems often bringing their newborns for care. There's a lot of fragmentation. There's difficulties with transportation. And one of the big fears is the Child Protective Services. Next slide. We know that women who live in shelters while pregnant have worse outcomes, both for themselves and for their fetuses and newborns. So they have a higher risk of having a low birth weight and preterm baby. And this has a lot to do with evictions, of losing homes, of being involved with intimate partner violence, etc. So there could be multiple reasons why women have unstable or insecure houses. And we actually know that there's a higher increase in adverse child experiences as well. Next slide. This is just some of the data, which I would let you look at in your own time, about a comparison of homeless women compared to women with stable housing, a study that was done in Massachusetts. Next slide. We also know that individuals giving birth in communities impacted by historically racist housing policies are much more likely to be experiencing historical trauma, which obviously will affect the pregnancy, much more stress due to the instability, and greater both indoor and outdoor environmental risks, both within the homes that they may be forced to stay in, may be unsafe, or the communities may be unsafe. And there was one study, and all the references are at the end: infants of parents in communities impacted by historically racist policies are more likely to have a preterm baby. Next slide. And I couldn't do this talk without talking about violence and housing instability. and the problem of intimate partner violence, and it could be a partner or it could be any other family member, actually, and the effect on the woman, both physically, sexually, and psychologically, and her inability possibly to not be able to leave the home because she has nowhere else to go, or there's limited shelters for women experiencing violence in the home. And this is definitely amplified based on a woman's social and environmental community. Next slide. And that we know, and there's studies that show that intimate partner violence does increase while pregnant and in the postpartum period, and that the infants born to these women are more likely to suffer from low birth weight and require intensive care treatment. Next slide. The last thing one should really think about is sort of the housing conditions that women may have to live in. So that's what we mean when we talk about unsafe and insecure housing. They may be forced to stay in a place with mold or dampness, overcrowding, and unsafe communities in which they are forced to live. And this was one interesting piece. Women experiencing housing instability, like crowded housing, poor housing conditions, communities, and they were forced to move around, possibly stay on people's couches, were more likely to screen positive for depression and anxiety disorders, which ultimately will affect possibly bonding with the newborn, as well as care of the newborn. Next slide. And the next few slides are just some policy suggestions, which I'm not going to go through for lack of time, but these are things to consider. Shelters are really a Band-Aid, and we don't think it's the long-term solution. It's a temporary solution, but really what we need is safe housing throughout the state of Illinois that actually makes women and children a priority. And traditionally in Illinois, it has not been. And if nothing else, we're trying to raise awareness about the importance of caring for pregnant and postpartum persons and families with young children. So you'll see some suggestions here. This has to happen at a legislative level. It can happen in the state of Illinois. And we're really happy that there's going to be an Illinois interagency task force. And we're hoping that good work will come out of the state agency as well as federal policy. Next, I think the next slide is the last one. It's additional policy suggestions. Can you go to the next slide, please? Something that would be critically important is paid family leave. And it's even hard, it can't even pass at a federal level yet. So lots of work to be done. And I will end there and let Nancy do her piece.
Thank you, Dr. Geller. Good afternoon. Today, I am going to talk about the effects of homelessness, evictions, and housing insecurity on babies related to the brief but critical period following conception and through birth. Next slide. The three areas that we're going to cover are what happens in the womb, what are the risks at the time of birth, and what can we do to prevent infant deaths and other bad outcomes associated with homelessness. Next slide. We now have more than 20 years of studies which show that sustained extreme stress alters a baby's development in the womb. The stress is not specific to homelessness, but includes experiences like living with domestic violence, living in a war zone, and an ongoing natural disaster. Next slide. A parent's sustained stress level signal to the baby that she needs to prepare for a world filled with danger. Although not helpful in our modern era, this was probably an advantage to early humans who lived in a physically hostile environment. The first change occurs inside cells. DNA cannot be altered, but the expression of the gene can be affected. And this is called epigenetic change, and it can be passed on to later generations. The next set of changes occur to deep brain structures. And finally, the entire body's stress pathway can be altered. Next slide. I just want to say, it is not clear which babies will be affected by any of this and which will not. Imagine what it must be like to have a hair trigger fight or flight response. Do you remember the last time you narrowly avoided a car accident? Afterwards, you felt your heart beating fast, your mouth was dry, and your muscles were tense. You were probably a bit shaky. This is the fight or flight response. Now imagine a child whose body has been primed for fight or flight from minor triggers. For example, a 5-year-old in kindergarten who wants to bolt or strike out when a teacher lightly touches him on the arm. He will be at a severe disadvantage in school and in forming friendships with other children. Next slide. At the time of birth, as Dr. Geller has already mentioned, there are 3 well-documented risks for newborns whose parents experienced homelessness during pregnancy. The first is being underweight, even if the baby was born full term at 40 weeks gestation. Low birth weight can be associated with altered growth as a child, some neurologic problems, and future metabolic problems. The second risk is being born too early or premature. The lungs may not function well, and there are a host of other related problems. Prematurity or low birth weight can lead to the third risk, which is a stay in the neonatal intensive care unit with the attendant trauma of being separated from the parent, pokes and prods, and an unnatural environment, despite the best efforts of these nurseries to minimize noise, lights, and pokes. Next slide. A new study from Stanford University came out in August. They looked at California state databases and compared over 500 women who had experienced homelessness during pregnancy to over 1 million women who were housed during pregnancy. The women who experienced homelessness were more likely to have mental health problems, substance abuse, asthma, pre-existing diabetes, and pre-existing hypertension. Next slide. Their infants had, as we've already discussed, a higher incidence of low birth weight and prematurity. They also had a higher incidence of respiratory distress syndrome from those immature lungs, bleeding inside the head, intraventricular hemorrhage, which can be the result of stress at the time of birth, and neonatal abstinence syndrome in those babies whose mothers had substance abuse problems. Next slide. Matthew Desmond, the author of Evicted, was part of a study looking at the effect of evictions on pregnancies over a 16-year period in Georgia. Individuals who were pregnant when they were evicted were compared to individuals who had been evicted prior to pregnancy. This is the same study that Dr. Geller mentioned in her talk. Their outcomes were compared. As you can see, the women who were evicted during their second or third trimesters were the ones who had the highest risk of having infants with low birth weight or prematurity. Next slide, please. In their conclusion, the author said, these findings suggest that eviction actions during pregnancy are associated with adverse birth outcomes, which have been shown to have lifelong and multi-generational consequences. Remember the epigenetics change that we talked about a little bit earlier. Next slide. What can we do to stop infant deaths and other bad outcomes? Next slide. In 2020, Pediatrics Journal published a study of state and local spending patterns from across the country to see which were linked to a decrease in infant death rates. Investing in housing turned out to be one of the most effective returns on dollars spent. Next slide. Other worthwhile investments included public health, but not hospitals, solid waste disposal, and parks. We keep learning that nature is good for us. Next slide. A small pilot out of Columbus, Ohio concluded this past summer. Pregnant individuals who were housing insecure but not yet homeless were given either rental assistance or the usual supports without rental assistance. The two groups were compared. In the group which received rental assistance, 22% of their babies were born with either prematurity or low birth weight. But in the group that did not receive rental assistance, twice that percentage, 45%, were born with those problems. Even more alarming, but not considered statistically significant because this is such a small study of 99 pregnancies, there were 4 fetal deaths in the group that did not receive rental assistance. Next slide. Here are their takeaways. Next slide. Unstable housing, evictions, and homelessness during pregnancy increase the risk of significant adverse outcomes at birth, throughout life, and to subsequent generations. Next slide. Conversely, stable housing supports better outcomes for healthy babies and their futures. Thank you. I will also be sending out a lot of references. We don't need to look at them right now for people who want to do more in-depth reading. Thank you.
So now we will be moving to our